Patients recovering from severe burns over large areas of their body experience some of the most intense physical pain a human can endure. To manage this agony, they rely on regular, heavy infusions of morphine. In 2012, neuroscientist Fabrizio Benedetti and his team conducted a study with these patients. Without telling anyone on the ward, doctors secretly swapped the patient's midday morphine infusion with a completely inert saline solution, essentially salt water. The patients didn't notice the swap, and their pain dropped as usual. Functional MRI scans confirmed a physical change. The neural networks responsible for processing their pain quieted down, exactly as they would have with actual narcotics. The researchers then reversed the experiment. The next day, nurses administered actual morphine, but this time they told the patients they were only receiving a harmless saline solution. The patients cried out in severe agony. May had received their full, normal dose of morphine, but because they expected a useless saltwater drip, the strongest painkiller on earth had zero effect. A single expectation completely blocked the chemical properties of a powerful narcotic. The physical reality of the drug surrendered to a thought. To understand how a thought overrides a narcotic, we have to look at a biological mechanism called top-down processing. The brain is not a passive receiver that simply waits for pain signals from the body. Instead, its executive function operates as a commander, sending direct physical orders down through your neural networks. The primary fuel that drives these commands is expectation. Your brain code is designed entirely to keep you alive and maintain your well-being. When you understand how top-down processing functions, you can consciously direct this mechanism to alter your own biology. For most of us, top-down processing runs entirely in the background, out of our conscious control. In medicine, this subconscious execution is known as the placebo effect. Researchers at Harvard Medical School tested this by prescribing dummy sugar pills to patients suffering from irritable bowel syndrome. The doctors explicitly told the patients they were taking a placebo, yet 59% of them still experienced a physical improvement in their symptoms. This effect scales up to highly invasive procedures. In a separate study, half of a group of patients with severe knee inflammation received actual surgery, while the other half were merely anesthetized, cut open, and sewn right back up without any mechanical repair. The patients who underwent the fake procedure reported the exact same level of significant pain relief as those who had their knees mechanically repaired. Confronted with these results, some doctors argued that the surgery should be completely canceled, since it performed no better than a placebo. They missed the core finding. The physical expectation of healing is in itself a highly effective medical treatment. A doctor's bedside manner, making eye contact, showing empathy, and building honest expectation, directly dictates the treatment's overall success. If placebos trigger the executive function without us realizing it, the next logical step is figuring out how to trigger it on purpose. This active control is the foundation of biofeedback therapy, a method used to help patients like Ali, a young surfer struggling with intense anxiety. This animated flowchart shows how the process works. By observing real-time physiological data on a monitor, like an elevated heart rate, a person can use intense motivation to consciously send a command from their executive function down to the lower order areas of their body, physically forcing their pulse to slow down. But there is a catch. The moment the patient disconnects from the machine, their heart rate usually spikes right back up. The new behavior hasn't taken root yet. To make this top-down command automatic, the patient has to practice the process repeatedly. After several sessions and at-home practice, Ali physically rewired his neural network, making his lowered anxiety permanent. Conscious biological change requires persistent repetition and a high degree of motivation to forge new, lasting neural pathways. These studies show that expectation is more than a feeling. It is a neurological tool. It determines how your executive function manages attention, memory, and the filtering of information. You can successfully apply this exact same physiological mechanism to your own daily life without any medical equipment or clinical intervention. The process begins by defining clear objectives. By making a written list of specific wishes for the next 6 months, categorized by health or family, you provide your brain with a concrete data set to prioritize. clarity is essential because your executive function requires specific parameters to direct your attention toward the best possible scenario. Reading these items aloud encodes the messages. Once stored, your brain begins operating with these new priorities in the background as you go about your daily routine. This illustrates the brain's internal management. Your executive function is now primed to sort the wheat from the chaff, filtering through thousands of daily data points to identify and prioritize only the crossroads and decisions that align with your stated messages. By directing this top-down flow, you manipulate your own preferences to be consistent with your goals. Whether used for pain management or navigating personal choices, enhancing your top-down processing provides the physical framework for making positive changes permanent.